Family planning programs impact women's health by providing universal access to sexual and reproductive healthcare services and counseling information. Family planning also has far reaching benefits which go beyond health, impacting all 17 Sustainable Development Goals, with higher focus on goals like no poverty, good health and well being, gender equality, decent work and economic growth, and reduced inequalities. An estimate done by Ministry of Health and Welfare in India states that the current unmet need for family planning is met over if met over the next 5 years, India could avert 35,000 maternal deaths and 12 lakh infant deaths. If safe abortion services could be ensured along with increase in family planning, the nation could save approximately USD 65,000 million. Yet, the fourth National Family Health Survey states that almost 13% of women have an unmet need for family planning, including a 6% unmet need for spacing methods. The consistency in these numbers since the National Family Health Survey of the third round in 2005-2006 suggests that despite increasing efforts to create awareness on the subject, there is an existing gap between a woman's desired fertility and her ability to access family planning methods and services. At the London Summit on Family Planning held in 2012, the Government of India made a global commitment to provide family planning services to an additional 48 million new users by 2020. According to the Family Planning 2020 Country Action Plan, the government aims at focusing on modern method contraceptive prevalence rate (MCPR), keeping in mind the current annual MCPR method of contraceptives has a rate of 1% as compared to the 2.35% annual increase required to reach the FP 2020 goals for India. As a signatory of the SDGs in 2015, India has committed itself to achieving good health and well-being as well as gender equality by 2030. In 2015, the announcement of the introduction of three new contraceptive methods, injectable contraceptive, Centroman and progestin-only pills by the Government of India, indicated a much-needed shift from the terminal method of female sterilization, which accounted for two-thirds of contraceptive use in India until 2015-16, to more modern limiting methods of contraception. Empowering community health workers to ensure better quality of care involves capacity building of community health workers, the training of frontline workers, greater emphasis on training around community mobilization and counseling for contraceptive technologies, addressing myths and misconceptions prevailing in the communities regarding modern methods of contraception. Access to contraceptive choices, quality counseling services, information and follow-ups can ensure that the unmet need of millions of women across the country. And finally, quality services cannot be provided in the absence of adequate infrastructure and commitment and unbiased service providers and frontline workers. Women's health goes beyond providing technical solutions or increasing the availability of contraceptive methods. Of tremendous significance is a women's agency, choice, and access to quality reproductive services. Addressing critical indicators such as child marriage and early pregnancy and early access to safe abortion services for women is extremely important for individual and societal well-being and for the nation's development as a whole. A systematic review of 23 programs from Africa, Bangladesh, Nepal, and India conducted by PFI showed that social pressure to prove fertility, insufficient knowledge on contraceptives, and limited decision-making power among women were the main reasons for the high levels of early pregnancy. India is among the countries with the highest for the number of girls married before the age of 18. The country needs policies in place that empower women rather than those that restrict access to contraception. The National Health Policy 2017 talks of increasing public spending to 2.5% of the GDP, which is a welcome sign. However, much higher health allocations are necessary to take forward the nation's family planning agenda in favor of reproductive health and rights. The government's newly launched Mission Parivar Vikas program focuses on improving access to contraceptives and family planning services to 145 high fertility districts in 7 states. In addition to higher health allocations, the government needs to ensure efficient and complete utilization of funds already allocated to family planning activities. Thank you.